Having been in primary care for the past 6 years and now transitioning into more of a specialty clinic, specifically for diabetes and diabetes management, it's exciting for me to now be part of a specialty clinic to help be a support and a helpline for primary care. So the Diabetes Center really brings about a comprehensive care plan for patients. The docs, the providers, nurse practitioners, the physician's assistants, all are staying up to date with the state-of-the-art, the most up-to-date treatment modalities, whether it's new insulins, whether it's new other hormone injectables, new other oral medications, staying up with all of the guidelines from ACE and the ADA about what's appropriate and what's effective for patients. Also, we are very comfortable managing pumps, which that's a whole different aspect of care when we talk about patients' diabetes and insulin management. We also have on staff every day, we have at least 2 certified diabetic educators in the office every day. We also have nutritionists. We also have social workers and care managers that actively help to improve the patient's life. Diabetes can be a pretty difficult thing to manage, and that's really where the Diabetes Center comes in. We have a large amount of tools, a large amount of opportunities to really make diabetes a livable diagnosis. Even 15, 20 years ago, that wasn't necessarily the case. We had a very limited scope of medications, whether it was oral and or injectables, specifically insulin. And even in the last 5 to 10 years, we've had a large amount of newer options. As we talk about diabetes and the multi-prong approach to that with specialists and the educators and the social workers and care managers and all these different aspects, when we look at Spectrum Health is a multidisciplinary institution. And when we start listing off all these potential specialists, that might be a necessity for patients, but specifically diabetics moving forward, we have all of that access right here, right now, today. So if you, the patient, come into me and you're starting to have some new neurologic concerns or you're starting to complain about some vision concerns, we can make that happen for you in a very timely manner. And most of these specialists that we're sending you to are right here at Spectrum Health. And we can get you into them in a very quick way, and even are seeing these other specialists on a routine basis. And so that whole collegial nature here at Spectrum Health exists, and it exists well. And I think that's one of the great aspects of being at Spectrum Health, is that we have a multitude of opportunities and a multitude of resources that we can really put at the disposal of our patients. Again, diabetes can be very debilitating, but diabetes, if we embrace it and we work together on it, we can get people living normal lives and living normal lives for a very long time. That's the exciting thing for me.